All right, so you're hoping to just crush that upcoming nursing job interview, right? I bet you are. Today we're going deep on an article from Rezoom called Nurse Interview Questions: How to Ace Your Nursing Job Interview. It's like having a secret weapon for getting ready.
Yeah, it is a really great resource because they lay out all the different kinds of questions that you're going to face, and they break them down into like 7 different categories. You can kind of think of it as a map for how the interview is going to go.
Like a roadmap. Mm-hmm.
Yeah. So it starts with general questions, which are just, them getting to know you. And then it goes deeper into like, your experiences and skills.
So they're like slowly trying to get a better picture of you as a potential colleague.
Yeah,
And if you know that's coming, you can be more prepared.
exactly. And it really covers everything from like your clinical knowledge and your teamwork skills and patient care and ethics and even like those tricky scenario questions that they like to throw in there.
Oh, yeah. Those are tough.
Yeah.
Okay, so let's unpack this roadmap a little bit. So first off is general questions. These seem pretty straightforward, but I'm guessing there's more to it than meets the eye.
Yeah, you're right. They may seem simple, but it's really your chance to make a first impression. They're looking for someone who's not just qualified, but also passionate about nursing.
So when they ask, why did you choose nursing? It's not enough to just say, oh, I like helping people, or I like science.
Right, exactly.
You've got to have a better answer than that.
That's where, storytelling comes in. Think about, what made you interested in nursing in the first place? Was there a personal experience or, someone who inspired you? You really want to share a genuine story.
That's a good point. I like that. Okay, so how about those behavioral questions? Those can be tough to handle.
They can be,
Yeah.
but they're a good opportunity to show your experience and what you've done in real-life situations.
Mhm.
Remember, those behavioral questions are all about predicting what you're going to do in the future based on what you've done in the past.
So they're looking for concrete examples.
Exactly.
Times when you had to deal with challenges and work with other people and just prove yourself as a nurse.
Yeah, and that's where the STAR method comes in. Have you heard of that?
Yeah, I have.
Okay, so it's situation, task, action, result.
Yeah.
And it's just a really helpful way to structure your answers.
Okay, let's break that down. Let's break that down for our listeners.
Sure.
So what does STAR look like?
All right, so let's say they ask, describe a time you dealt with a difficult patient. So you would use STAR to kind of paint a picture for them. So first you start by describing the situation, like maybe you had a patient who was anxious or, really uncooperative. Then you would explain the task. What were you supposed to do in that situation? Was it to, give them medication or explain something to them or just calm them down?
Okay, so far so good. Now what about the action part?
Yeah, so that's where you get to really shine. You describe, the specific steps that you took. How did you talk to the patient? What did you do, to help them?
This is where you show off your skills and experience.
Exactly.
Now the result.
The result is basically wrapping up the story and showing what happened because of your actions. So did the patient calm down? Were you able to give them what they needed? Were there positive outcomes?
So the STAR method is just to help you tell a story that highlights your ability to handle difficult situations.
Right.
I'm sensing a theme here. It's not enough to just say, I'm good at dealing with difficult patients. You have to have an example to back it up.
Yes, exactly. And when you use the STAR method,
Mm-hmm.
choose stories that highlight the skills that they're looking for in this particular job.
Mm-hmm.
So it's like you're showing them that you've already done this and you were successful, so you would be good at it in this job.
That makes a lot of sense. Okay, let's move on to clinical knowledge and skills.
Yeah.
This is where they're checking your technical know-how.
Yeah, they want to see if you understand the, core stuff about nursing, the procedures, the best practices. They want to make sure you have the clinical foundation.
Right, because you can't just be good with people. You have to know what you're doing clinically.
Right, exactly.
So if they ask something like, what steps would you take to assess a patient with chest pain? They're not just looking for a textbook answer, right?
No, they want to see you use that knowledge, and they want to see how you think and how you would approach the situation step by step. So showing that you're logical and you have a system is really important.
So even if you don't have all the answers memorized, you can still impress them by showing how you think and problem solve.
Yeah, that's a good point. It's not always about getting the right answer. It's about show them how you think.
Nursing is all about teamwork.
Mhm.
So I'm guessing teamwork comes up in the interview.
Oh, absolutely, yeah.
Yeah.
It's essential to nursing. So they're going to ask you questions about how you work with other people.
So what kind of questions would be in that category?
Well, they might ask about how you handle conflicts with coworkers or, how you make sure that communication is clear, when you're handing off a patient, or how you contribute to like a good work environment.
So for a question like, how do you handle conflicts with coworkers?
Mhm.
You'd want to have an example that shows you can resolve disagreements and keep things positive.
Yeah, they want to see that you can navigate those interpersonal issues and that you put the team first.
It's not about placing blame, it's about finding solutions.
Exactly.
All right, now let's talk about patient care and empathy.
Oh?
This is where the heart of nursing really shines.
Yeah?
And I'm guessing the questions are all about showing that you really care about your patients.
Yeah, absolutely. They want to understand how you interact with patients, how you build that connection with them, and you know how you deal with difficult situations with compassion.
So a question like, describe a time you went above and beyond for a patient. That's your chance to show you're dedicated.
Yes, exactly. It's a chance to tell a story that highlights your commitment to giving really good care.
It's about showing them that you really care about your patient's well-being.
Right. And that you're not just there to, clock in and clock out. You actually want to make a difference.
You see your patients as people.
Yeah, as individuals.
Okay, this leads into the next category, nursing ethics and professionalism,
Right.
which are huge, obviously, for any nurse. What should we know about this area?
These questions are going to be about your understanding of ethical principles and your commitment to professional standards.
So they might ask, what would you do if you saw a coworker doing something wrong? Or how do you make sure you're keeping patient information confidential?
Yeah, exactly. They want to see that you can handle ethical dilemmas and that you're going to put the patient's safety first.
It's about showing you're not afraid to speak up if you see something wrong
Right.
and that you're going to do the right thing even when it's hard. Okay, now get ready for the curveball, the scenario-based questions.
Okay.
Those sound a little scary. What are those all about?
So they're going to give you like a what-if situation and ask you how you would respond. They want to see how you think on your feet.
Oh, so like a little simulation.
Exactly.
So what kind of scenarios might they throw at me?
Well, they could ask something like, what would you do if a patient refused treatment? Or how would you decide who to help first if you had multiple patients needing your attention at the same time?
Okay.
Yeah.
So it sounds like there's not one right answer to these questions.
Right. It's more about how you reason through it and the decisions you make.
They want to see your problem-solving skills.
Exactly how you take in information,
Yeah.
how you consider your options, and ultimately how you make a decision that keeps the patient safe.
It's not about having a perfect answer. It's about showing you can think critically and adapt.
Mm-hmm.
Wow, this article is really good. So is there any other advice that it offers that can help us nail that interview?
Yeah, it does feel like we've covered a lot,
We have.
but I bet there are some even more like golden nuggets in this article
Oh,
that can help our listeners, really ace those interviews. So what else should they keep in mind?
Well, it's not just about knowing the questions. It's about how you approach the whole interview.
So, like, one thing is researching the organization you're interviewing with.
Makes sense. It's like you wouldn't go on a first date without, like, looking them up on Facebook or something.
Exactly. You got to do your homework.
You gotta do your homework, yeah.
And it shows that you're serious about the opportunity.
Yeah.
If you take the time to look at their website and, read their mission statement and understand what they're all about.
So when they ask, why do you want to work here?
Yeah,
You can go beyond a generic answer.
exactly. You can show them how you fit in.
You can really tailor it.
And speaking of tailoring, another tip is to brush up on common procedures,
Yeah.
especially ones related to the job you're applying for.
Oh, that's a good point. So, like, if you're going for a job in cardiology, you want to make sure you know all the latest about EKGs and stuff.
Exactly. You want to show them you're ready,
You're prepared.
clinically prepared, and ready to go. And of course, practice makes perfect.
Yeah, that's true for anything, right?
Is.
But how do you recommend practicing for a nursing interview? I mean, you can't really practice with, like, a real patient.
Right. Well, you can practice like telling your stories using the STAR method.
Right, yeah.
Think about common questions and how you would answer them. Focus on being clear and concise.
So you don't want to sound like you're reading from a script.
No, but you do want to feel prepared.
Yeah, you want to have those stories ready to go.
Exactly. And this might seem obvious, but dress professionally.
Oh, come on.
You'd be surprised how many people don't.
Who doesn't know that?
First impressions are so important.
That's true.
You want to show them you respect the opportunity and you respect the profession.
It's like dress for the job you want, not the job you have. Okay, what else?
And last, make sure you have all the necessary documentation, organized and ready.
You mean like my resume and licenses and certifications and references?
Yes, have it all in a folder.
It shows you're organized.
Exactly. You don't want to be fumbling around.
Yeah, that wouldn't be a good look.
Oh.
So we've talked about the questions, the preparation, the logistics. It feels like we've covered it all.
We've covered a lot, but there's one more thing.
Oh, there's one more thing. Okay. I'm intrigued.
This is really important, and that is passion.
Oh, passion. Okay.
Genuine, heartfelt passion for nursing.
I mean, you would hope that anyone going into nursing has that, right?
Well, yes,
Yeah.
but it's not just about having it. It's about showing it.
So how do you recommend doing that?
Well, think about what excites you about nursing.
Right.
Is it helping people? Is it the challenge? Is it being part of a team? Let that guide your answers.
So when they ask why you're interested in the position, you can connect your passions with the specific role.
Exactly. Let them see that spark, that you really love what you do.
Because at the end of the day, they're not just looking for someone who can do the job.
Right.
They're looking for someone who will be a good fit for their team.
Right. Someone who sees nursing as more than just a job, but as a calling.
It's like, finding a job you love and never working a day in your life.
Right.
And if you really love nursing, it will show.
It will. And that genuine enthusiasm,
Yeah.
that can really make you stand out.
A lot of communication is nonverbal, too. If you're really excited about nursing and about this opportunity in particular, they'll feel it.
Exactly. And that brings me to something I was thinking about. As you prepare for your interview,
Okay.
what is it about nursing that you're really passionate about? Like, what really gets you excited?
Oh, this is making me think back to when I had job interviews.
Yeah.
So why do you think that question is so important when you're interviewing?
Because that passion is your superpower. It's what makes you different from everyone else you know. And it's going to help you succeed, not just in the interview, but in your whole career.
Right.
So take some time to think about it.
Yeah.
How are you going to show that passion in your answers? How you carry yourself, everything.
It's like that passion becomes part of all your answers.
Yeah, it connects everything.
And it makes it real.
It's not about, faking it or being someone you're not. It's about being yourself and letting that love for nursing come through.
To all of our listeners out there who are getting ready for nursing interviews, you got this. You chose an amazing profession.
You did.
It takes a lot of skill and a lot of heart. And now go out there and rock those interviews.
We're rooting for you.
That wraps up our deep dive into acing those nursing job interviews. We hope you found this helpful. And remember, preparation is key, but so is being yourself. Let your passion shine through and you'll be on your way to that dream job.
That's right.
Until next time, keep learning, keep growing, and keep diving deep.